Healthcare for me was just scary. It was very much like a grocery store checkout line. You put your problems on the scanner, they scan them, they give you a receipt essentially and send you on your way. I felt like I was just kind of going through this revolving door of a cycle of crap. They were just kind of shrugging off my symptoms or my feelings and just kind of willing to give me whatever medicine I was asking for and send me on my way. I needed 2 open heart surgeries because I was born missing my right ventricle. I had my first one when I was 4 and my second one when I was 16. Being a kid with cardiac issues, I go see so many doctors every year. And one of the tests I get, they put stickers all over my chest. And a big thing for me as a kid was removing those stickers. Like, I've already had all this trauma in my chest, like, let me do it myself. And I've had so many doctors just come in and just rip them right off. Not even ask, just rip them right off. So kind of compiling all of that just in years of going to doctors and not really feeling heard has just created this kind of large pit of medical anxiety for myself.
I started the health center in 1973. We've sort of viewed this from the start as part of this social movement to provide care to everybody. And then our approach to medical care, I would just say that we've been open and able to do innovations. For example, we always thought that having counseling available was useful and helpful to people. We had psychology people in-house, so to speak. And it's a lot easier to get somebody to see somebody for counseling who's in-house as opposed to going an extra 10 miles into town, so to speak. We've been in a position to innovate because we're not in anybody's control except our own. I first learned about the impact of trauma on health from the seminal work of Dr. Folletti, who had done the initial work in California, showing the relationship between traumatic events in people's lives and their long-term health. As it turns out, when people have any of a number of bad things happen to them when they're growing up before they're 18, it turns out these things have long-term impact on every illness and every sort of problem that we have in health. It turns out it increases the risk of cardiovascular disease, diabetes, the likelihood of smoking, cancer. Virtually everything that's a task that we need to take on in healthcare has an adverse impact from adverse events, and it's lifelong.
Trauma-informed care really gets at the critical concept that trauma is more widespread in our population than we originally knew. Organizations that work in healthcare, that work in mental health, even education, have come to recognize that a lot of the patients, clients, students that they interact with will have experienced some kind of stress or adversity in their life that has impacted them to the level that we call trauma. And so if you're in a primary care setting or if you're in an emergency department in a hospital, the chances are certain that you're going to be interacting with children and adults who've experienced some kind of trauma in their lifetime. And so the concept of trauma-informed care is that we now understand that really everyone who's in some kind of helping profession really needs to understand what trauma is, how common it is, and how it impacts people.
How's it going?
Good. How are you?
Oh, not so bad.
Catch me up. What's going on?
Yeah, so I finally got the appointment with the rheumatologist.
Yeah. I feel like trauma-informed is a system where people feel respected and they feel acknowledged. So, and you also saw cardiology, if I am right?
That seemed to go well, and the test results came back unremarkable. So I feel like that's a good sign. in medical
Unremarkable
speak.
means boring, which is really good.
Perfect.
Yeah. I also think that trauma-informed means more than just chopping people into little pieces and looking at, we have the medical science of being able to look at the DNA and, down to these tiny pieces, which is incredible. But how can we put it all back together into one big whole? How is your body actually feeling right now?
Good.
Yeah.
Good.
So, if it's okay, I'd just like to take a quick listen to your heart and lungs and maybe check that eardrum. Okay.
Having doctors and nurses in your healthcare team recognize the fact that you have some trauma and understanding how to help in some other ways that aren't necessarily your typical, and instead kind of coming from a place of how can we take care of the whole system of your body, including your mind and your physical body.
Wow, how great that you're tuning into your body and actually paying attention and honoring that. I mean, that's amazing.
Yeah, and it really does make a difference just in my quality of life.
Yeah, good.
I had not heard of trauma-informed care until I got to the health center. I've been able to actually get the care that I wanted and needed, and it's really allowed me to grow as a person and move past a lot of the issues I was dealing with.
It sounds like maybe you're all set, but
Okay.
think about if we can help you in any way. Let me know.
Yeah.
The squeaky wheel gets the grease.
Yeah.
So
Yeah.
If you need some help being,
Squeaky.
advocating, let me know. Yeah. Whatever we can do to support you, that's our job, is
Awesome.
to help you, connect all the dots. So.
Yeah. And it's also really allowed me to feel less scared to go to the doctor. But getting to know that, we're both going to try and make the right decision for me has been really helpful and definitely helped in quell some of that medical anxiety for myself.
Trauma, that's a scary word, especially when you say it in a medical community, because of course they think injuries, bad injuries, which it is really. I think the benefits of trauma-informed care are seeing the whole person. It's also being able to have practitioners, clinicians, and staff that are far more compassionate and that can understand themselves better, as well as people and patients every day have a history and a background. And it doesn't mean that you've been traumatized, but it's how the impact that things have on us, day-to-day life have on us. And I think by studying that, we can all be more understanding.
I deal with nutrition and food and our relationship with food. And when you're dealing with food and changing food behavior, you're not just dealing with the food. You're often dealing with many layers of resistance to change. So we want to work with people where they're at. We have to understand where they're at first.
I saw a patient about a month ago who was terrified to go to the dentist, but one of our dentists who does sedation dentistry saw him and it went very well. And this man said, just his voice brought me down from being very anxious. So this dentist has mastered a way of talking to somebody pre-sedation, which calms them down and instills confidence. So our effectiveness for everyone should improve if we can interact with them in a way that's better understands their position.
In dentistry, a lot of people have had traumatic experiences in the past. It's very, very frequent. We get people coming in, especially some older patients, and they said, when I was a little kid, they didn't used to numb you up before they did a filling or took your teeth out, and they've had this horrible experience with a lot of pain in the dental office. So because of that past trauma, they avoid the dentist pretty much their whole lives, and then we see them later on in their life, and they've got a lot of big issues that we need to address.
Trauma is something that we need to be aware of all the time, and not in a, oh my God, someone, is sick from trauma, or I'm, different because I've been traumatized. It can also be a way that someone is 10 times more resilient than someone else, and that, they have an amazing history that, could be related to other people, and how strength comes into that. And we need to hear stories about strength and about survival too.
I'm doing construction right now about 2 days a week on Fridays and Saturdays. And when I'm not working here, I have class on Tuesdays and Thursdays for chemistry. I'm always working 5 days a week, usually 6, because if I don't work, I can't pay my bills. And if I don't go to school, I can't do what I want to do. I can't help other folks in the future. I was doing Vermont Youth Development Corps. I was leader for the group. While I was with the group, I really didn't know what I wanted to do with my life, but I did end up finding some hope in creation, which resulted in me deciding that I wanted to be an engineer. And now I'm going to Vermont Tech to become an architectural engineer. And it's honestly like the first time I felt like I'm myself. I've actually discovered myself here, and it feels really good. Growing up, and even starting in middle school, like I always wanted to help out others, and I don't know, it was that idea of serving my country and, giving back. When I graduated high school, I went straight to the Army. I think it was within a month or two of graduating, I was in the Army. And, it was basic training. A lot of really long days of punishment, and they really try and break you down and build you back up. The basic training is all about breaking you back down. When we eventually got around to eating, they ended up giving me an MRE, and in the MRE was a bunch of stale old Skittles. And when I was eating them, one of them cracked open my tooth, and I had to go to the doctor the next day. The doctor gave me ibuprofen. My battle buddy that went with me needed to get his wisdom teeth removed, and he got Percocets. Being a young, dumb kid, I really didn't understand the difference or the importance of what drugs were and what Percocets were. And so when he offered to give me one, I happily accepted it. And he gave a couple more away to other people, and we eventually got caught. Yeah, that's when everything just collapsed. That was my life, the Army. That was who I was and what I wanted to do and what I wanted to be. And suddenly like that, it was gone, and I could never be in the Army again. And it was one of the most crushing experiences I've ever had. So when I got back from the Army, I really didn't know what I was doing with my life, and I wasn't doing well mentally. Nothing was working out. I coped by drinking, and that's when I really started to have a little bit of a substance abuse issue. And when I came up here, I started to realize that I can't be my best self while I drink. And I moved up to Vermont about 4 years ago, I think now. I became a patient at the health center. I was just seeing a doctor, but I very quickly started seeing a therapist as well. One of the first things that I think was helpful for me is just having somebody that wanted to listen to what I had to say. More than, hey, we want to help you get over what you're dealing with, but more of what is it that you dealt with? Tell me about it. Receiving trauma-informed healthcare has helped me find the words to start talking about my experiences and actually process what I experienced. And just to acknowledge that emotional response is a delayed response of something that you've dealt with earlier. And so for me, a lot of it's been diving into those emotional responses and trying to understand where is that really coming from. And once I've started to see where it's coming from, then I can more or less try and find my own words to comfort myself around those issues or difficulties or whatever it may be.
We've been attentive to trauma-informed care, so we said, what can we do that can work on a day-to-day basis and be integrated with what else we have to do, which is take care of people in all of the broader sense of primary care. To try to give everybody an opportunity for ACE screening. ACEs stands for Adverse Childhood Experiences. We use a laminated sheet. There are 10 questions. Did this happen to you when you were a kid? So it's a list of adverse consequences ranging from what's obvious, sexual, physical, or emotional abuse, to much less obvious. Like, was there enough food in the house? Did somebody in the family have to do with drug abuse? Did anybody go to prison? And there are people who have 0, none of this happened, or I don't need to know what are the 4 things that somebody checked. I just need to know the score of 4. But the raw score has this enormous impact on healthcare, health outcomes, I should say. We know that, for example, an ACEs score of 4 or more, your life expectancy is 20 years less than what it would be if you were a 0, so to speak. I've said that I think that people we ought to get to the point where knowing somebody's ACEs score is as important and essential as knowing their blood pressure, because that's a way of understanding their risk for all sorts of problems.
I started doing screenings for adverse childhood experiences in the exam room in 2016, and it was a pilot thing that was only going to last about 6 weeks. And as soon as I got going with it, I knew that I wanted to keep going.
I think the importance of ACE screenings in medical settings is it provides an opportunity for people offering the care to really understand what they're offering care for, right? And so someone can come in with a stomach distress or some physical ailment, and we might just try to treat this physical manifestation of trauma or harm, and without an understanding of the ingredients that really went into the development of the body and of the person's mental health or wellness, then we might miss a lot of the picture.
What I do is, once you've gotten permission and you've created the atmosphere of trust, I generally spend several minutes just saying, all right, I just want you to listen for a few minutes about a few things about this study called the ACE study that was done back in the mid-1990s. And I talk about it, and then I kind of go on and say, would it be okay if we looked into what your ACE score might actually be, and then I can give you some feedback about how that might be impacting your life today. I realized I had no idea, and I can't predict who's been through a lot of trauma and who hasn't. And there are times when people tell me things that it's so horrific and so, like, it's almost inconceivable to me that anybody could live through it and even like walk into the door. And sometimes people say, when I ask them, how many other people in your life know about this? They'll look at me and say, you're the only one.
Our relationship with food has origins way back in our development. So anything that's disrupting development at an early age is going to impact how we relate to food, what food means to us. It's often the first coping mechanism that we have as a child. The closest thing for us to be able to comfort ourselves is food. So that's a pretty deep relationship. That's pretty intimate. So the more I know about what food means to that person, the easier it's going to be for me to help them to find a way to change their behavior.
So ACEs, we try to integrate it into the check-in procedure, so to speak. It could be posted like a blood pressure. It's a vital sign in a certain sense in the chart. And then we try to deal with it as a tip-off to risk that we need to try to assertively address. We try to figure out what are the basic things that everybody could do. So we're promoting walking. And remember, we're in a rural environment. Walking in a sort of forest or outdoor environment is actually better than walking down a sidewalk. So we have that advantage in Vermont. So walking, trying to shift people toward fruits and vegetables, more Mediterranean diet. It's anti-inflammatory as compared to processed foods. And then there are 3 supplements that are anti-inflammatory. One is called N-acetylcysteine. It provides the basic ingredient from which we make the most powerful anti-inflammatory substance in our body, which is called reduced glutathione. Fixing their vitamin D, checking their level, getting it to the proper level is anti-inflammatory, reduces disease. And getting their magnesium fixed, which is a a real blind point in the sense of the public and much of medicine.
I think in terms of when you think about trauma-informed care, it means more than just doing an ACE screen or educating people about this stuff. It's also, it's almost like a lens that you see through. We get burnt out and we get tired, like, oh, the eye rolls, like, you know, why can't this person just stop drinking? Why can't this person just lose weight, you know? And then you think about somebody who has had 1 or 2 or 3 or 4 or 5 or 10 adverse childhood experiences. And I mean, they're literally on the ground. And even to just get to the starting line of life is a huge accomplishment that needs to be respected and acknowledged and validated.
So I found the health center because when I moved here in 2019, I was still very much on my healing journey, and I had recently learned about adverse childhood experiences. So my first appointment, Kim Pierce asked if I wanted to do the ACEs survey. So, you know, it just was a pile of questions, and I was able to just say yes, no, yes, no. I didn't need to go into anything. And we went through a bunch of yeses, mostly yeses.
All right. So we have the community life at 11, right? Yes. Okay.
And she was surprised at how high I scored while being a functional member of society.
Wake up.
I know people who have had insane amounts of trauma.
Okay.
Being able to see that and put a number on it helps to bring it out of the emotional realm a little bit and into the logical realm where you can actually process those things a little bit better.
You know, I try to give some options of things that would be helpful, therapy among them, but I feel strongly a lot of this stuff is the healing that happens from childhood trauma is mostly done outside the exam room. And I will tell a story about a patient that I saw recently who was older and she'd been struggling with alcohol for most of her life. She came back and wanted to tell me that she'd stopped drinking. And I said, wow, what did you do? Like, tell me, share me with me. And she said, well, this is gonna sound kind of strange, but many years ago I used to paint. And I decided that I wanted to paint, but I didn't want to just paint like the outdoors or the things that I used to paint. I wanted to paint a picture of that alcoholic part of me, that woman that used to drink. She said, because I kind of missed her. You know, she was pretty cool. So I painted her, she tells me, and I could look at her, but she wouldn't come into my space, but I could see her whenever I wanted to. And I was blown away. The concept of integrating the creative self in order to find healing is not something that the medical system really talks about. You usually don't get, you know, you go to your doctor and they tell you to go home and write poetry or draw or paint, but it's the people, I've seen it over and over, that tap into their creative self that are able to really do this healing in a way that we can't do inside an exam room, but you can offer it and you can acknowledge that that might be more powerful than handing somebody any medication.
So as part of the community life department, it's part of our responsibility to orient students to the campus, but also to the academic programs, to what community life is like. Because we largely have Zoom participants, they're not able to go on the in-person campus tours, but also winter is a thing. January in Vermont's pretty scary. But so, just want people to be able to experience campus in different ways that they wouldn't be able to from home.
dial it in, do what you gotta do.
All right. Well, I think I'm gonna do it now.
So, because I already have skills in editing and filming, I said there's got to be a better way than just another email, right? So, I was like, screw it. I'm gonna make a video. Part of what this place is, in my humble help desk opinion, is that when you come here, you have your own experience. I'm trying to change the ways in which we communicate with students so that it can be less formal while being, more connective. Just more us, as opposed to Outer College is a great place, this and that.
The buildings need some work.
If I can help myself and put myself in a community where I am supported, then I have enough stability around me so that I don't have to build my own stability. This is critical work because it's not just about healthcare. It's also about society and how we are with each other.
Thank you, good sir. Cheers.
We understand that about 60% of all individuals in the community have been impacted by at least one adverse experience in their childhood. And around 20% of our population has been impacted by 3 or 4 different forms of adversity during their childhood. We know that childhood trauma in particular changes the way a person experiences the world and can lead to physical health concerns later on in life. So because it's so widespread and because it can have lifelong impacts, we really need to treat it as a population health concern. And so really all healthcare providers should become trained on understanding and responding to trauma. Everyone in that organization, especially senior management, but also providers, so doctors, nurses, administrative folks who might welcome you into the office, if there are security guards, right? So that everyone in an organization should be offered baseline training on understanding the prevalence of trauma in the community.
One of the unfortunate realities of being a human species is we have incredible ways that we harm each other, and we continue to harm each other. Unfortunately, trauma is human condition. Unfortunately, we continue to invent terrible ways to harm each other. It is unfortunately, part of human condition. So we just realized that it is human condition, and that by naming it, we have much more chance of preventing it.
Our structure has always been that we were independent and could innovate. And, we had a big training course so all of our staff would understand better that this impacts people's lives.
One of the things that we also have to recognize is that makes us very vulnerable to misusing that power. Not intentionally, but nonetheless consequentially.
We believed that everybody on our staff being aware of this would make them more sensitive to people who might have a traumatic background. I hope that the implementation of trauma-informed healthcare is just part of a continuum that we've already begun. I think it'll change the way receptionists deal with the patient, whether they're at the window or on the telephone. I think it'll change the way our billing people, helping people get their bill paid or their insurance established or something. I think we're going to end up with a staff that's more sympathetic and effective in addressing people's needs.
I'm going to paraphrase. Viktor Frankl said, between stimulus and response, between action and reaction, we can create space. In between that space is our power. And in that power is our chance to determine, with intention and deliberation, how we want to respond to the precipitant, to the agitation, to the client that just cursed at you or threatened you. Because most of what you see in your clinic that is problematic to you is not intentional, it's not willful, it's not purposeful. It is a consequence of stress.
When I heard that they were going to do a training on trauma here at the health center, I was very interested and also very pleased that we were going to do that, because I think it's a topic that we tend to sort of hide under the carpet a lot and not pay enough attention to. So I was very happy to hear that. And I know that the health center does a lot of novel and very progressive things. So I'm not surprised that they were going to do this, but I was, very happy that I was here and could be a part of that.
One of the slogans, one of the mantras we use in trauma transformation is we are interested in brilliance and not brokenness. In the trauma world, particularly in mental health, we have been focusing too much on brokenness. We have DSM, we have a book this thick full of brokenness. And you have, in health, you have your, catalog of all different kinds of illnesses. It doesn't mean that we don't have to pay attention to illness and injury, we have to. But it does mean that I, sometime around 12 or 15 years ago, got tired of the way my profession focuses on brokenness and not brilliance. Because I have yet to meet a client, regardless of the circumstance, that if I didn't scratch a little bit below the surface, I didn't find brilliance. Because I have. Every freaking client that I work with has an incredible level of brilliance. It often gets dirt poured on top of it because of what trauma does.
Just having the awareness that patients have been through traumatic events, it'll increase the empathy and compassion that staff have for patients who are extremely anxious, and the patient might just come off like really grumpy or angry or whatever, but they're really just super, super fearful and anxious.
I learned about trauma-informed healthcare actually after I'd gone through school. It was at a continuing education conference for diabetes educators. I'll never forget it. I remember hearing the research, hearing the results, and being shocked that we had had these results for over 10 or 15 years and that nothing was happening with them that I could see in healthcare.
Part of being trauma-informed is being able to detect stress in your own body. Stress is contagious. If you're highly stressed, it's going to impact your client work and your patient work. Now, I absolutely believe that stress is community property, and that in order for you to be trauma-informed as an organization, you've got to embrace the idea that your stress is a collective, that none of you can regulate your stress by yourself.
Nobody's done this before. This has been done a lot in education. And so when teachers and people that run schools and deal with children in education, when those people have this kind of training, it turns out that disciplinary problems go down and academic achievement goes up. We think that this will have the potential to make health outcomes improve and the process of helping people with their health more effective and comfortable for them. But we've been knowing about this information from Folletti for like 30 years, and it needs to be taken to the next level, so to speak.
But what a lot of people don't know is stress is contagious bidirectionally. In fact, the most useful way to regulate a dysregulated person is to remain regulated. Easier said than done, but it is worth proclaiming and emphasizing.
I think it would make us more sympathetic and effective working with them, for us to realize that everybody doesn't have an even start. Everybody doesn't have the same familial or economic privilege. So I hope that this training will make all of us more sympathetic and more effective in dealing with the people we take care of.
For organizations to do what's necessary to really become trauma-informed, really, first and foremost, requires buy-in from the very top level leadership. It really includes the need for an organization to make cultural changes and place at the center of their values. And then in my experience, the second piece is time and persistence. Initially, I think organizations begin with large-scale training. They may bring all of their staff together, and they may have a single-day training on understanding trauma. Following that, there really needs to be the development of some kind of cohort of champions within an organization who are willing to say, I will be a part of continuing to bring best practice, current research, and ongoing training discussions to our organization. And because it's culture change, it really does take a handful of years.
For a year or so, we met every week about this. Remember, there's staff turnover, there's competing needs, but how do you keep this as a priority? Over and over the years in medical practice, if you have a little funding and maybe a staff member dedicated to something, we do it pretty well. And so then when you don't have the staff member and the dedicated funding, things, they tend to lapse because other things come to the fore. And in our area, the doctors are just being flogged to go faster, and they're dropping like flies. They're retiring or just dropping out and saying, I'm not going to do this. And so there's a lot of turnover. So we have a handout that says, here's the basics. And so we try to kind of get people to read the handout, and we have to kind of rehearse them on this. And so I think that's a very pertinent question, how to keep this alive as a concept. So I think, first of all, where we would hoped it might be different from what we thought it might be. We've always known that it was a bit of a heavy lift to get people to pay attention to this. I think we've done pretty well with that, so people could say, yeah, we know it's important, this and that are the consequences. It would actually, interestingly, get done more if it became something that was reportable. People are very tuned into the data. How many people did I see, and did I properly take care of their blood pressure? If ACEs were reported in that same way, I think it would help.
There are a lot of barriers to creating trauma-informed care, especially within a medical system that doesn't really support such things. The barriers include just not a lot of people not knowing about it. There's no insurance coverage for it, in terms of like actually happening within an exam room. I think there's resistance about trauma-informed healthcare because of fear of the unknown. And fear of triggering people, and also just the topic itself is sort of inherently fraught with a lot of resistance, and people often just get turned off by the word trauma-informed, and also sort of opening up a Pandora's box almost.
To another health center or provider considering instituting trauma-informed practice, I would say you could just dive in and start. We'll give them our questionnaire. That's in public domain. Talk with your care group. We're going to have these screening numbers. Here's the implications of those numbers. And it's not dangerous or Pandora's box. We're going to upset the patient. It will comfort them. And at the very least, you can say, let's concentrate on these real basic things that everybody can do. This concept is simple. It's not threatening to patients. It's easy to integrate into the routine of care. It's just a matter of informing clinicians, and they work with their staff, and making it just part of the routine.
A lot has been asked of people who work in healthcare, myriads of problems that the pandemic has challenged us with. But I have to think that this particular project is necessary now for many reasons, and I think it's definitely the right time. I don't think there's a wrong time to ever do this, because it's a long time waiting and coming. And I would say, why not now? Because it's needed more than ever.